Hello guys, so welcome to the Pharmacology QnE session and I'm Dr. Ankit, your pharma faculty at PrepLadder. So we will discuss how to approach QnE notes, but before that let's focus on one question which was recently asked about the different cephalosporin and their uses in which infection. For a moment we can see this question, but don't worry, we will discuss this question after learning the names of cephalosporins. So if we open our QnE notes, there is a big question which is written that define the roles of cephalosporins, their classification and their clinical application. And the answer which is written is that cephalosporins, they are beta-lactam group of antibiotic. So we have discussed that beta-lactam contains penicillin, cephalosporins, carbapenems and monobactam, and all beta-lactam group of antibiotic in a bacteria, they inhibit cell wall synthesis. Now, if you talk about cephalosporins, they are further divided into 5 generation, first to 5th generation. So now the next question is, classify these cephalosporins into different generation, their uses, and how to remember their names. So there is a beautiful table which is given in our QnE notes. Let's just zoom on this table for a moment. So if we zoom on this table, we can clearly see that cephalosporins, they are divided into 5 generation, first, second, third, fourth and fifth. Now remember the first generation cephalosporin, they are the best cephalosporins we have for gram-positive bacteria. And we very well know that Staphylococcus aureus is a gram-positive bacteria. That is why first generation cephalosporins, they are given for MSSA, which stands for methicillin sensitive Staphylococcus aureus, against which certain penicillins like methicillins are also effective. But the point to be noted is that they are not effective against MRSA, which stands for methicillin resistant Staph aureus. So what is the use of first generation cephalosporin? We very well know that Staphylococcus aureus is a bacteria which is commonly found on skin. Now just imagine you are doing a surgery in your patient. As you give a surgical incision, don't you think this staph will enter into the bloodstream of the patient? That is why to kill this Staphylococcus on the skin, before doing surgery or giving surgical incision, we give first generation cephalosporin. That is why they are considered to be the drug of choice for surgical prophylaxis. They are given at least 30 minutes before skin incision. Now, how to remember the name of these cephalosporin first generation? Remember, first generation cephalosporin, they will start with the word Cepha, which may contain Fa, or Cepha that contains PHA. So Cepha or Cepha word will come Fa or PHA. So if I'll ask you, there is a drug known as Cefoperazone. Very well, you will mark it as first generation cephalosporin. Similarly, Cephalexin, Cefadroxil, and Cefoperazone being an IV drug, it is considered to be the drug of choice for surgical prophylaxis. But there is one exception we have to remember, except Cefaclor. Remember, Cefaclor also starts from the word Cepha, but it is not first generation, it is rather classified in second generation cephalosporin. Now let's come to the second generation cephalosporin. They are the best cephalosporins we have for anaerobic bacteria. Just like an example, bacteroids. Bacteroids is an anaerobic bacteria. But remember one rule, any anaerobic infection occurs, we straight away give the drug of choice as metronidazole. So because of this reason, nowadays, second generation cephalosporins are very less commonly used. Their use has been taken up by metronidazole. So one drug we already know is Cefaclor. Another drug, just wait for a moment, we will classify how to remember. Now let's jump over to third generation cephalosporin. Third generation cephalosporin, they are best for gram-negative bacteria, which produce community-acquired infection. So if we see this pattern, as we are going from first generation to third generation, Can we say we are moving from gram-positive to gram-negative bacteria? And they are given for those gram-negative infection which spreads in community. So can you recall certain infection? Can we say typhoid, which is caused by Salmonella typhi, is a gram-negative bacteria? Neisseria meningitidis, which causes meningococci, spreads through aerosols in community. Similarly, we have gonococci or gonorrhea, which spreads through sexual transmission. And similarly, we have Haemophilus influenza, which also spreads through air droplet. So any gram-negative infection comes, which spreads in community, straight away go with third generation cephalosporin as our drug of choice. So let's talk about how to remember their name. These drugs, they will end with the word zeme or zone. Zeme and zone word will come in third generation cephalosporin. Again, one exception is there. Again, that exception is in second generation. The answer is cefuroxime. So try to remember these two cephalosporin. Cefuroxime ends with the word zeme, but it is in second generation. So if I'll ask you a word, let's say there is a drug cefixime. Zeme word is coming. Similarly, cefoperazone, cefotaxime, and a very famous drug ceftriaxone. So they are third generation. They are the drug of choice for gram-negative community-acquired infection. So there was a recent question. What is the drug of choice for the treatment of meningococci? Yes, a third generation cephalosporin, ceftriaxone. Similarly, if I'll ask you a question, what is an oral drug for gonococci or oral drug for typhoid? You can go with cefixime. So just identify the word zeme and zone. But the another exception we have to remember, they are given for all gram-negative infection except one bacteria. They are not effective against Pseudomonas. They are not effective against Pseudomonas, which is also a gram-negative bacteria. Now, which third generation cephalosporin are effective against Pseudomonas? Very simple. Just identify the last alphabet Z. They will contain Z alphabet. So if I'll ask you a question, Cefoperazone, ceftazidime, ceftolozane, they all are having Z alphabet in them. They are third generation anti-pseudomonal cephalosporin. So if I'll ask you that ceftriaxone, is it having Z word in it? The answer is no. Cefixime, having Z word in it? The answer is no. Will they be effective in Pseudomonas? The answer will be no. Now, fourth generation cephalosporin, they are also best for gram-negative infection. But remember, they are given for those bacteria which rather produce hospital-acquired infection like ventilator-associated pneumonia, catheter-associated UTI, bloodstream infection due to catheter. So these bacteria, you will rarely hear their names in a community infection. So if I'll say a name of a very atypical bacteria, Acinetobacter, rarely you see its transmission in community, but in hospitalized patient, it can cause ventilator-associated pneumonia. Similarly, Klebsiella, a very common cause of UTI. Similarly, Burkholderia. So these bacteria are gram-negative hospital-acquired infection. Here we give fourth generation cephalosporin, and how to identify their name? Identify a word pi in them. So if I'll ask you, Cefepime, Cefepirome, they will be fourth generation gram-negative hospital-acquired infection. So now the last cephalosporin is fifth generation cephalosporin. It is the only cephalosporin which is effective against MRSA, which stands for methicillin-resistant Staph aureus. And how to identify their name? Just identify a word ROL. ROL word will come in them, and we can very well identify ceftaroline, ceftabiprole. ROL word is coming. So let's make a summary. If I'll ask you, Cefa word is coming. First generation surgical prophylaxis except Cefaclor. Zeme and Zone word is coming. Third generation gram-negative community-acquired infection except cefuroxime. Both exceptions are in second generation. Pi word is coming, fourth generation. ROL word is coming, fifth generation. Keep it as simple as much. Now, few other points which are given in our QnE notes are that there is a cephalosporin which we have to remember, many times question come, that is cefoperazone. So you can see cefoperazone, opera word is coming, a beautiful music, and opera, its era is over. Why? Because nowadays nobody hears opera. Its era is over. So cefoperazone, opera word, era word is coming, and remember three era. Cefoperazone, E for it causes excessive bleeding. Why? Because it decreases fibrin level. Just like a drug warfarin, the risk of bleeding will increase. R for it is renal safe. Which cephalosporin is renal safe? Cefoperazone. And A for it must be avoided in alcoholics. Why? Because cefoperazone produces disulfiram-like reaction. Now, last point is that all cephalosporins, they are not effective in which infection? We can remember a mnemonic, lame. So, cephalosporins, they are not effective against Listeria. In Listeria, we rather give ampicillin. It causes meningitis. They are not effective against atypical bacteria like chlamydia, mycoplasma, because chlamydia and mycoplasma, they lack cell wall. They are not effective against MRSA except 5th generation cephalosporin, and lastly, they are also not given against enterococci. In enterococci, sometimes causes endocarditis, we rather give vancomycin. So this is about cephalosporin. Let's recall our question which was recently asked in our exam. So match the following cephalosporin with their respective use. Now let's apply our knowledge. First cephalosporin is cefazolin, and we can see cefazolin is starting with the word cefa. So can we say it must be under which generation? It is a first generation cephalosporin. It is given to kill Staph aureus on the skin. It is given for surgical prophylaxis. Then we have ceftriaxone. It is ending with the word zone. Zone means it is third generation cephalosporin, which is given for community acquired gram-negative infection like meningococci, gonococci. The drug of choice is ceftriaxone. Third, we have ceftazidime. It is having Z word in it. So can we say it is a third generation with Z word in it? And whenever the Z word will come, we will go with Pseudomonas. And lastly, we have ceftaroline. Roll word is coming. So it is a 5th generation cephalosporin, and 5th generation cephalosporin are effective against MRSA, methicillin resistant Staph aureus. So yes, our question will have the answer of option number B. So this is about a short and crisp revision of cephalosporin from our QnE notes. Best wishes, keep learning always.